Hi, welcome to my expert series where I bring you trusted insight to help you live well, plan smart, and age with confidence. I'm Kelly Stain, a residential realtor here in the Philadelphia area, and today I'm here with Heather Esham, and she is with Senior Independent Living Companions, in-home care company, SILC for short, but Senior Independent Living Companions. So thank you, Heather. I'm here in your cute office here in Royersford. Thanks for having me.
Thanks for coming. This is exciting. This is my first shot in my new office.
Well, great. I'm glad to be first. Okay, tell me what SILC is, how it started, and just a little bit of what you guys do.
Okay. SILC is non-medical companion care for older adults aging in place as long as possible. So we come into their homes, we assist with the things like light housekeeping, meal prep, transportation, scheduling, showering, dressing if that's needed. Anything that a family member would do that maybe is not able to do because they're out of state, they have full-time jobs, or they just need a little bit of a break.
Okay, so that's a lot and very helpful. One of my questions was going to be, and kind of we're answering it, but how does someone know, a family member such as myself that I'm caring for parents or loved ones, know when it's time to hire someone like you?
Oh, that's a great question. It varies. Sometimes older adults know on their own. They're lonely. A lot of times when you don't drive anymore, you've lost a spouse. Losing your car and not being able to drive is a major loss of independence. So having somebody come in that can take them to the grocery store, be an extra set of eyes to check in, take them places, that's a sign. So loneliness, loss of independence is another thing. Also, if you start seeing that your family member is not having as good of hygiene as they once had before, or their house is a little bit messier, or they're sleeping, they're not eating as much. These are all can be signs of depression, but also signs that there's something else going on that maybe having somebody in there to help with these things would be good. And like I said, we're another set of eyes for family members just to check in and see how mom and dad or aunts and uncles or how anyone's doing.
So kind of like if their habits are different, you're noticing that.
Right, like if you go, a lot of times after family gatherings, you'll notice that the holidays is a big time because families are all together and they're like, oh, mom's not as social as she used to be, or her clothes are wrinkled, or dad he seems really tired and depressed. Those are a lot of times when we get calls, like I think something's going on, and it's better to start the process earlier than later, because when you start later, it's usually in times of crisis. So it's rushing to get things done. If you can start earlier with one visit a week, maybe, we specialize in 2 to 4 hour time blocks is what we take smaller amounts of time that as they need more care, somebody's already there and in place. So it's helpful to the family.
Yeah, I mean, one of my things is why I do this is planning smart. So how can loved ones plan for this? I mean, you don't know if you need it, but how can they plan basically of
talking
ahead?
Start the discussion. The older generation didn't talk about things, to be honest, and they're the hardest generation right now, is because they've done so many things on their own. They're so independent that asking for help is not something they want to do. Plus, this generation also wants to stay in their homes as long as possible, and or change the home to fit their needs, or downsize, which is where you're super helpful in as well. So like finding new things, but starting the conversation early with people and talk about it, because you don't have to make any adjustments, but saying, hey mom, dad, you're thinking if you this place gets too big for you, you have 3 floors, when you think about downsizing, have you thought about what you do when you need help? So just talking early on is a big deal.
Yeah, that's huge. The whole bedroom plan, right?
It is. I mean, they just don't like to talk about, I'm an open book, and I think our generation talks, or my generation, I'll speak for myself, but just talks about things a little bit easier. I started the conversation with my parents a long time ago and feel really secure in that I know what they want, I know where their important documents are, their living wills, things like that has to start early on, not later.
Yeah, definitely. Okay, so talking is huge, talking about various things. Tell me a little bit of what you guys don't do, maybe.
We do not do anything that's healthcare related. So wound care, when anything that a professional would need to be doing. We don't diagnose. We don't, we can take blood pressure with a blood pressure cuff, but we're not doing vitals. We also are not a company that is doing a lot of transferring or are in bedridden. We're more independent seniors that need some help. And as they need help further along and they need help toileting or showering or dressing, we're there. But when it gets to be out of our scope of care, then that's when we refer them to a company that's better suited to do that type of work.
Right. Okay. I guess companion, which is in your name.
Yes.
That makes sense.
Yes. Right. Yes. And companion personal care. So sometimes, personal care is people are fine. And then all of a sudden, they need a little help in the shower. Or a lot of people are afraid to shower. One of the most important things you can install in your homes is grab bars. Anything that you can do in your house just for safety, not a non-slip mats, things like that, because you fall when you're older and you go into a hospital and rehab, it's a lot to recover. So little things that you can do in the home earlier on is great too.
Okay. So if I'm looking for someone to help my parents, say I'm out of state or something, how do people find you, but also choose like a provider? What are some things that people should look out for? There's
a lot of companies out there. Obviously, there's a lot of big name companies too, that there's franchises. They just have to do their research. They find we're word of mouth. We're a local company. That was one of the things I wanted to be in our local community here and build our reputation here. Google is the best way to do things. And then look at reviews, contact them, ask questions, interview. You have to meet with somebody. And one of the most important things, which I think SILC is really good at, is keeping the same companion. A lot of times you hear that there's different people coming in the house. Well, if you have somebody with dementia or you have somebody that's nervous about having someone in their home, you don't want different people coming in different times. So we really keep that companion so it becomes their person and build that relationship. So that's a question to always ask too. Like, is it the same person? Be bonded, insured, licensed, all of those things.
Okay, those are my other questions. Oh, what other things should kids or loved ones ask when they're reaching out to these companies?
Bonded, insured, licensed. We are a licensed home care agency in the state of Pennsylvania. Get audited every year. Just questions. Obviously, one of the first questions is cost, and you don't always go by cost. You get quality over, sometimes you have to dive deeper and to find out a little bit more about the person why the company started, who their caregivers are. Again, I'm smaller, so I'm particular on who I hire, and the people I hire are doing it for the right reasons. Yeah. It's not just putting bodies in homes. So they just have to ask questions and meet with them. And sometimes you get a good feel from that.
For sure. Yeah. And I guess location too,
Absolutely. Area. Like we're Warrior Sword, we service a 15-mile radius. So I think in larger companies too, even if they're franchises, they'll have a company, a franchise in Skipback, and then maybe one here. They don't want to overlap, and you don't want your caregivers driving too far either.
Yeah, that's a good point. Okay. What other things can we help the consumer, the public, like help plan and know that you guys are a good option? Like maybe it's parents that are, or loved ones that are ill, or they just came out of the hospital. Like what are other triggers to help us be like, okay, we really should call someone to help mom and dad?
That's good. We will do short-term care too. So think about like hip replacements, knee replacements. People come home from the hospital. They need help with laundry, light housekeeping, changing their linens, making meals. So it can be a short-term too, which is great. We'd love if we get clients and have them for a month or two, and then they're doing great.
And that makes sense. After like surgery or something.
After surgery, exactly. That's another thing. People that have children out of state, they can't get there. Someone who's a caregiver and needs respite, that is doing all the work themselves. If you're a caregiver and you're doing all the work, you need to take time for yourself, or you're not going to be able to help anybody. So another is somebody who's doing all the caregiving, a daughter, a son, a husband, or spouse, that just needs to get a break so they can go out for a little while and do things that are important to them, is another good reason to call.
Yeah. And are you, or I guess most in-home care companion type companies, the similar of like 2 hours a week or 4 hours a week, or is that kind of unusual for?
We're a little different that way, and I
Okay.
wanted it that way because I saw what my grandparents needed. And sometimes you don't want somebody in your house for 5 or 6 hours. You feel
Yeah.
like that's another hard thing for clients is they feel like they have to entertain you, and that's not what it's about. We're there to make their life easier and their families' lives easier. So everyone has their different minimum. That's a good question to ask when you call. What is the minimum amount of hours that
Okay.
you will service somebody? Ours is 2. Just as the visit's 2 hours. It can be once a week. It can be every day for 2 hours. Some places require, 4 to 6 hours as a minimum. So you really have to understand what level of care you need when you're calling a company and see if that's too much or you want shorter amounts of time. Figure out what that is too.
And you do transportation?
Oh, yes.
Okay.
And helping schedule doctor's appointments. I mean,
Okay.
think about how long you're on a phone to
Yeah.
make an appointment or schedule. We can take that off the family member's plate, schedule it from when we're there with them, take notes, get it back to the kids or the spouse, whoever wants to know the information. And it's always good to have a second set of ears when you're the doctor. I mean,
So you'll go to the appointments.
Mhm. If they're comfortable, we'll go back, sit with them, take notes, do all of that as well.
Are you for hire for me? For non-elderly?
Non-elderly. We've had some younger people, but I don't think the type of scheduling you're needing for sure.
Okay, it's really helpful.
But
I mean,
talk
to
to your
have
kids
these.
about the future. I don't know if you. Yeah.
No, but it's true. I mean, people need help, and
Yeah.
it's nice if you are able to just do certain number of hours a week or a month, like after surgery or after whatever, instead of ongoing.
It's peace of mind for the family, and that's what we try. Most of the calls that we get are the family members, not necessarily the client themselves. We do get that, but it's the family member saying, I'm seeing a change. My parents are a little reluctant to have this. Can you come talk to them? Let them know what it's about. And once they hear and they feel comfortable, they look forward to those visits because it's cheap therapy. You're paying someone you can vent to about, your family members, and they're not going to say anything. So we are like a therapist, a good listening. That's one of the most important things we can do is listen to our clients. Yeah.
Any other tips of what we should be looking out for or when to call you?
I think the first sign of loneliness is we saw from COVID what isolation does to people mentally and physically. If you notice that someone is just not getting out and doing things like they used to, I mean, just someone coming in, let's go to the dollar store, let's go to the grocery store. Getting out and about around people is just so important. And I think that's one of the main things we learned with that horrible time frame that seems like so long ago, but wasn't very long ago. Is just, keeping social and mental stimulation is important for physical health and mental health.
I 100% agree. That's why I think it's great to move to active adult communities, or if you're on the older side, maybe even an independent care.
Absolutely.
Because of the activeness and you're doing something instead of just in your home.
I agree. And we're all for aging in place. That's what we do. But we go into communities as well to help people. And if, we've had some clients that, recently have been thinking, do we stay in our home or do we move into a community? And they're weighing the pros and cons. The wife is very social, so she's seeing the social aspect of it. And that's something you really have to talk to your family and really think through. Okay, how many more years do we want to do this? Start looking at communities and just exploring them, like an open house, right? An open house or housing. Go and look at them, see what they have to offer, and then make your decisions on, do I want to stay here? Can I get the care I need if I need it in my home for a period of time? Or is that a benefit to downsize or to go to a community?
Right. It's all about planning and having those conversations.
So and having the conversations.
You know your options, and then your family knows your options. You know what? If we're not here, we can't, there are people to call, such as yourself, to help, to be our eyes and ears. Because I do agree, being there on a consistent basis, you are their eyes and ears, and you can see if they are, getting
and
worse.
We see the changes, right? Yeah,
see the changes better, and you can convey that to the
I had
family.
a lady that contacted me 2-3 years ago and signed all the paperwork and did everything just for in the future if she needed us. Never has had to use us, but just was like, I want to know that this is there. You have me in your, like, it's just funny that she was just thinking with her daughters, and I was like, sure, we'll do that. it's been a while, but she was just really actively thinking about her future and knowing that somebody was out there that she could call. I think that's a peace of mind too.
Yeah.
And like I said, the hospital stays and rehab, coming home from rehab. We'll do physical therapy exercises with them. We're not physical therapists, but like you come home from rehab, they want you to continue doing your exercises. So you have someone come do the other things and then say, okay, it's time to do your exercises. Let's get you strong. And then hopefully they don't need us very long. But
you just reminded me, my daughter broke her elbow, and afterwards we had to do like, activities with her when she got her cast off and stuff. But I'm thinking, do you find that family members will listen to you guys more than their children? So say if I'm caring for my parents or loved ones, like she would have done it better, not us telling her to do it, but someone else. Well, do you find that too?
Oh my gosh, definitely. And also, we have more patience than the family member. So think about like your impatience always goes to the ones you love the most, right? You take out your frustrations on your families. It's because it's easy. So the patience we have is a lot different, because if mom and dad are not listening, we can say it with a different type of authority, I guess.
Yeah, that makes sense.
But yeah, they will listen to us more, and also just we just have more patience, I think, when it's not your family member, for sure.
Yeah, and especially if they're all living together, and it's like the sandwich generation, right? Where they're taking care of them and taking care of, so then everyone just gets frustrated. So having someone else come in to like.
And they didn't have that. Think about it. Like people weren't living as long, right? Yeah. So people are living, I did an article, 80's the new 60. I mean, to me, like when someone says they're 72 years old, I'm like, oh, that's young. Like I remember thinking 72 when I was younger is older. I mean, it's not anymore. We have clients that are 100 and 101 years old. So, gosh. I mean, people are living longer. So the sandwich generation is real, and it's going to be for a while. And I think this is a new thing, because just people with medicine and healthcare and progress in different things out there, they're just living a longer life, which is great. Yeah. But it's also harder on the sandwich generation, because you're worrying now about your older parents and your children at the same time. So if you can get help to take some of that off of your shoulders, why not, right?
Well, tell us how to contact you. How do we find Heather and Silk?
You can contact us, our website, silccare.com. So it's SILCCARE.com. You can call us. You can go to the website. Go to the website. It's easier. But we're local in Royersford, service a 15-mile radius. And thank you for coming to talk to us. It's passionate about seniors. So anytime I get the chance to talk about it, I appreciate it. Thank you.
Yeah, thank you. This was really insightful. Thank you so much for allowing me into your office too.
Thank you.